Thanks, everybody. Thanks for having me. So as Jason said, I didn't realise that I had sent my bio before I had moved over here. So I was in clinical practice. I'm an osteopath by trade, and osteopaths in Australia are not medical doctors. We study for 5 years I did a bachelor and a master's course, and we work as predominantly manual therapists, and usually in a private practice setting. So that was where I was just before we made the move to Oregon about 8 months ago. And so I'm not hands-on at the moment, which is why I'm quite happy to speak to people about their tricky cases when they email through, because it keeps my brain alive. So you might be wondering why an osteopath is standing up here today talking about cognitive behavioural therapy, and it's certainly something I've been thinking all morning. The reason I started to develop an interest in CBT and other psychological modalities in the treatment of chronic pain was driven when I started doing this Masters in Pain through Sydney University. And as you look to the literature, you get that initial crushing sense of, oh my goodness, nothing we do works particularly well for chronic pain in the manual therapy setting. But as you look across the literature, CBT as a clinical entity in the treatment of pain started to stand out because it gets often better clinical outcomes than anything comparable, perhaps about the same as what we would expect from exercise, but certainly beating most manual interventions. So I started to look into it a little bit more, read about it more. I did some courses and got a little bit of supervision and started incorporating some of the techniques into my clinical practice, and found it to be incredibly effective. So I started to talk a little bit more about it and start the discussion. So today I'm going to present an argument for why manual and exercise therapists should look towards this as a clinical entity, and what we can do about that with that knowledge, what we can do with that. So first of all, I'm going to take you through a brief literature review and a little bit about the history. So it's not going to be a comprehensive literature review, but just exposing you to some of the information. So CBT became known through the work of Aaron Beck and Albert Ellis, and it was a move away from the more traditional psychoanalytic models. And what it did was it recognised the role of thoughts and their effect on modulating emotions and behaviour as well. So CBT is an umbrella term that encompasses quite a few things, so dialectical behavioural therapy, acceptance and commitment therapy, which we're incredibly lucky to have Kevin Vowles speaking to us about tomorrow morning, and things like cognitive processing theory. And it's based on this kind of idea here, where it's the interaction between our thoughts, our emotions and our behaviour, and how if we have an influence on one area, we can make changes in that system. So we can target our intervention perhaps towards the thoughts, or and see how that affects behaviour and emotions, or alternatively we can target our interventions at behavioural approaches and see how that affects the system. So it's a collaborative approach. It's supposed to be problem solving between the client and the therapist, so it's not being dictated to by the therapist. In general, the approach is to identify unhelpful thoughts and then review those thoughts with reference to the available evidence. Now, when I say evidence, I'm not talking about a literature review. I'm talking about, does that thought, how accurate is that thought, and does that fit with this process? And can we review that thought? If we challenge that thought and it doesn't quite fit the scenario, can we replace it with a more helpful or realistic thought? So then, in the event that we can't access our thoughts, which for a lot of people might be a possibility, can we look to behaviours, and can changing behaviours influence that system? So as I said, of all the research single modality approaches, and when I say single modality, I mean things like acupuncture alone for the treatment of chronic pain, or manipulation alone, or exercise alone, that CBT probably has the largest body of evidence, so there are many, many studies there, and also displaying superior outcomes to the other modalities. As I said, perhaps except for exercise, but it's very hard to compare. You're not comparing apples against apples. So this is